People here. All right, so good morning and welcome to another webinar Wednesday. My name is Selena Dorme. I'm the Manager of Engagement Capacity here at the First Nations Public Service Secretariat. I'm also from the Klahoose Nation in North Vancouver, and I am joining you today from our offices here in West Vancouver, which is on the unceded territory of the Musqueam, Squamish, and Klahoose Nation peoples. Today's webinar is about vaccines and the rollout, and specifically what a rollout would look like in a First Nation. So we have 4 different speakers here today. They're going to chat with you for a little bit and then we'll open it up for questions. First off, we have Chief Kevin Pesey from Klahoose First Nation, Mariah Charlson, President of Nuu-chah-nulth Tribal Council, Betty Louie, Emergency Operations Director from Tahltan Band Council, and Dr. Nell Wyman, Acting Deputy Chief Medical Officer for the First Nations Health Authority. So thank you all so much for joining us. Really appreciate you taking the time to speak and share your experience and talk about what a vaccine rollout is going to look like. We're going to start with Chief Kevin Pesey first.
So yes, I'm supposed to, I'll answer the questions that I have written or that you have written down here.
Yes, those are just some of the questions that you can address that was included. Okay. But of course, speak from experience too as well.
Sure. So the one question here is, what is the COVID-19 responses been like in your community? What have you done to prevent the spread of the disease? Being on a remote island, of course, it was very scary for our membership. We're a membership of 400 people, but we have 92 that live on the reserve. We've been very careful as this COVID was going through by buying food and delivering it, you know, every few days to the membership, so they would stay home instead of going into town. Yeah, a lot of our members were scared, especially for our elders. Where am I here? So when we did encounter having COVID here, we started out with 3 members. It went to 4 members. Right away, we jumped into action and had a great team, had 24/7 security. We had it at the top of the hill, that we were not letting anybody in. Broadcasted on social media for the island people so they wouldn't get scared and start rumors and know exactly what was going on with Klahoose, and reassuring them that we wouldn't have members wandering around the island until it was straightened out. And it was a huge success. We had a lot of support from our nation, and I was sort of worried that we were going to get backlash of, you know, not letting them out of the community or not leaving their yards. But yeah, it was very supportive and everybody understood. I think because they followed Sly Ammon's lead that happened before us, and that was all over social media. So that went well for us. How was the vaccine rollout communicated to the community members? I did a speech to the members, and I also went door to door and said that the vaccine was coming. A lot of the membership is like, okay, we might buy into it, but I would like to see a picture, you get it first. And I'm like, by all means, I will. The day that it gets here, I'll be the first one. And I'll shoot you the pictures that I got it. In the beginning, there was like maybe 60% of the people were for it. And the first day that went by, and a lot of people were saying, wow, that I didn't even feel the needle or the vaccine shot. And by the second day, everybody was comfortable getting that vaccine shot. And we ended up with 95% of our membership that got the vaccine. So I was very proud of our people. So basically I answered that, what was the community response, getting the vaccine. The response for us is like living in a remote area and having to be staying here. I think everybody was very excited to get this vaccine so we can actually come back to a normal life than what we've been going through for the last year. And what was my own experience like with getting the vaccine? I'm normally a person that hesitates, but following this through in the last year, I was excited to get the vaccine. My wife and I did a lot of study on it in the last couple of weeks and just never found a negative thing about it. So I was ready to go, and I was ready to get that shot and have our membership trust, you know, that it was safe and healthy for our membership. And what would you like? Other nations waiting to receive the vaccine. So yes, I recommend all the other First Nations, if you haven't got it, to get it. I'm on day probably 16, 17 now with absolutely no side effects. When I did get it, it's just like a flu shot. Of course, it's sore on the arm the night when you're laying on your arm. The next day, the pain was gone. Out of the 95% of the people that took it here at Klahoose, there was only one allergic reaction to one of our members that had a big welt on her arm. But after me talking to her, she says, every needle I get the same. So it wasn't just the vaccine, it's just allergic to needles. Other than that, we've never had a complaint from any of our members that have got the vaccine, and everybody's looking forward to the second dose of it. So that's my story.
Thank you so much, Chief Peace, much appreciated. We're going to go ahead and move on to Mariah Charlson, Vice President of Nuu-chah-nulth Tribal Council. Please let us know where you're joining us from and where the community members are, what community you're from.
Awesome. Thank you, Selena, for the warm welcome. Thank you, Kevin, for sharing your community's experience in the vaccine rollout. I am calling in today from the traditional unceded territory of the Tsishaht and Nuu-chah-nulth. I'm really happy in Port Alberni. That is where the territory resides. As Nuu-chah-nulth Tribal Council, we represent 14 nations all along the west coast of Vancouver Island. And much like the speaker beforehand, Klahoose, many of our communities are rural and remote. And so I'm going to go through these questions as thorough as I can within a short time frame. So the first question, how has the COVID-19 impacted the communities we support? So that initial lockdown is what really impacted our rural and remote communities the hardest, and we learned it the hard way. We learned it because that initial lockdown meant no more weekly nursing visits, no more weekly doctor visits, no more mental health supports, no more addiction supports within the community. So we had a real tough learning lesson with that one, and finding ways to allow these essential services to enter our rural and remote communities, even in times of risk. We saw that because one of our very small communities actually lost 2 of its members to the opioid crisis that we are experiencing. And that's where we really felt that hit hard, that our communities needed those essential services. They needed mental health supports and cultural supports. So that was a big learning curve for us. Of course, funerals have been different. Grieving has been different. Celebrating has been different. We've seen online potlatches. We've seen online language Zoom classes. Heshkut has a record of about 20% of all of their members participating in a language class. And it's as a result of COVID-19. What has COVID-19 response been like in our communities? What have you done to prevent the spread? So a big tlako to all of our communities, all of our leaders, because we have been going above and beyond the recommendations and orders from the Provincial Health Officer, Bonnie Henry, since the very beginning. So we have many communities that have been in various stages of lockdown, some complete lockdown, some communities implementing curfews, some communities implementing checkpoints. All have been done in an effort to protect our community members and to stop the spread of COVID-19. We've also changed delivery services. So as I had mentioned, some of our services, such as our mental health team, they decided to move things online and make it more virtual. And throughout that, we have seen great amount of participation from community members, which has been really cool to see. Many of our communities immediately activated their EOCs, which was really great to see. We have an emergency planning coordinator that is hired by NTC. His name is Casey La Rochelle, and he organizes these Nuu-chah-nulth coordination call meetings that I have the privilege of chairing. And that's an opportunity for all of our nations to share what's happening right now in their community, what's working right now in community, and where do we have gaps and how can we address that. So that's been really helpful in our ability to communicate with one another throughout this pandemic. How was the vaccine rolled out communication-wise? So essentially, once FNHA gets those vaccines on Vancouver Island, and once one of our Nuu-chah-nulth communities makes that priority list, then we're right on it immediately. Our NTC nursing team is reaching out to communities and they are helping the communities prepare. So one example is we'll use the community of Ihattasit, for example. They had an outbreak at one point. They had many active cases, and as soon as they were put on that priority list to receive the vaccine, our NTC nurses reached out, they started communicating, and they organized a Zoom meeting with the medical health officer. So of course, there were many questions, and that provided an opportunity for community members to ask those burning questions. That was very, very helpful for people leading up to actually getting the vaccine, and particularly for those people who were a little bit unsure. And really happy to hear Kevin say as well that, yes, I took it first to set an example. We saw that in our Nuu-chah-nulth communities as well, where we saw leadership say, absolutely, I'm doing this for not only for myself, but for the elders in the community and for the vulnerable. So that has been really exciting to see as well. The next question, if not all members would be vaccinated, how did you prioritize? So in our Nuu-chah-nulth communities right now, the ones that have been prioritized, we are doing a community approach. So that means everybody in the community, it doesn't matter if you're native or non-native. I'll use the community of Heshquit, for example. Right now, they have 2 multi-million-dollar projects for essential services, so plumbing services and moving to more greener, efficient energy. So a community like that has essential workers traveling in and out, the community approach means everyone over the age of 18 that qualifies, whether you're First Nations or non-First Nations. So that's the way that we've been rolling it out within our Nuu-chah-nulth communities, is really trying to reach that herd immunity of getting everybody who is eligible over the age of 18, particularly our elders and our vulnerable, to get that initial dose, and really hoping for great weather so that we could administer those second doses to our rural communities as well. And the next question here, what was the community response? So the response has been varied. Some communities we saw, herd immunity, and it was accomplished right away in Cayucit, for example. Lots of excitement, lots of nerves as well. But through positive messaging, an example of the positive messaging would be myself and the president of NTC, Judith Sayers, issuing a press release speaking about the importance of this vaccine and how it is a critical tool to stopping the spread of COVID-19. So a lot of that positive messaging and a lot of, showing off our really absolutely important elders who are receiving that vaccine. I mean, just 2 days ago, my parents who are elders received the vaccine on the dock in a house because the weather just wasn't possible for them to receive it when it was available to Heshquit residents. So we're seeing our communities working together, and it's really, really beautiful to see. What was my own experience? So because I am an off reserve member, and I'm happy this part came up, is I have not received the vaccine yet. I do live off reserve. Therefore, when the vaccine becomes available where I live, then absolutely I will be first in line to get it. And that's a common question we're getting because over 80% of Nuu-chah-nulth people live off reserve. And we have wrote a letter on December 18th, really pushing our provincial government to prioritize our off-reserve vulnerable population as well as a priority group. So that's something that we are advocating for at NTC. And that letter was issued on December 8th to Minister Dix and Dr. Bonnie Henry. And what would you like to say to other First Nations waiting to receive the vaccine? Do your research, learn as much as you can, learn about the fact that vaccines are not new. They're not new technology, and they have saved millions of people's lives throughout history. I really encourage anybody who can, 18 or older, to take the vaccine to not only protect ourselves, but our elders and all our vulnerable people as well. And that's my presentation for today. Thank you all for listening. Choo.
Thank you so much, Mariah. Much appreciated. Next up, we have Freddie Louie, Emergency Operations Director for Tahltan Band Council. Go ahead and unmute, please.
Good morning, everyone. My name is Freddie Louie. I am from the Tahltan Nation in the far northwest corner of British Columbia. I am actually located this morning in the community of Telegraph Creek. I actually live in Iskut. Telegraph and Iskut are 200 kilometers apart. I came here this morning because I actually work, my real job is with the Tahltan Band. I have worked in emergency management for 2.5 straight years. We had in 2018, wildfires burned through our community of Telegraph Creek, and I came on as the EOC director then. And I stayed on as a recovery manager for them and was just finishing that up. And then we ran into a pandemic. So I started working again full-time in emergency management. For my background is in administration. I spent 17 years as a health director. I worked 31 years in band administration, 17 years as a health director, 10 years in education, and then the rest of the time as a band manager until 2016 when I decided that I needed to take a break and go into something that was less stressful like emergency management. The pandemic, COVID-19, has had a severe impact on our communities in the sense that it has changed our way of life. Our lifestyle is supportive, it's community driven. You know, we're always gathering, we're always having some kind of events going on. Tahltans have been famous for their music fests and their dances and all the things that people enjoy doing. We haven't been able to do those for a long time. So it's created a real issue around the mental health side of things, and we've had to really focus on that. I'm looking at the questions just because I can't remember them. So our community, so how did COVID-19 impacted the communities you support? Like I said, it's really hard. Our communities are small, on average about 400 people. We have 3 communities in our territory. 2 of them are on reserve. And the third one is a mix of off reserve and on reserve, Indigenous and non-Indigenous. So When we set up our emergency operations centers, we have local emergency management committees. So each community has their own committee that deals with the local issues in terms of the pandemic. So if they make the decision whether they want to put up gates, whether they want to monitor, whether they want to provide, door-to-door support. And so basically the bands and the local administration do that. With our third community of Dease Lake, we have a combination. So we have Indigenous on reserve, and then we have non-Indigenous members participating in the Emergency Management Committee. So that one we find is a little bit harder to manage because of the artificial boundaries and barriers that are there. And it makes it difficult sometimes, but they are managing really well. To date, Tahltans in the 3 communities have not had a case of COVID. So whatever we're doing is working. And the emergency management teams meet weekly. We have since the onset of March, I think it was March 15th, we started when the World Health Organization declared a global pandemic. Our emergency management committees were set up, and we have met weekly ever since. Along with those meetings, we also have a lot of industry and work camps in our territory. So it gets harder to manage and stay focused on the goal. Our goal has been and will remain keeping our communities safe from COVID. And that's what we focus on, is making sure our elders are protected all the time. And so we meet weekly with the EMCs. We meet weekly with our industry partners because they play a large part in keeping our communities safe, making sure that their protocols and their processes are in place, they're strong, and that our people understand them. And we've had say in them so that when our community members come back from work, they're not bringing the virus in, as much as they're not taking the virus into a camp where that you could have a huge outbreak. So lots of moving parts, lots of things to take into consideration. 2 days ago, or yesterday actually, our leadership drafted a letter to our members who work in camps saying, if you end up in isolation, and camps have isolation bunks set up for people who if they test positive, go in there. If they've been in close contact with somebody who's been positive, they go in there as precautionary. So we don't allow our members to come home until they've served the 14 days of isolation. And that's precautionary measures, nobody's making that rule anywhere except us. And we've had precautionary measures in place from day one. Masks were mandatory in our communities from June, before the province made them mandatory. And our stores are limited to local customers only. People passing through can get fuel, but they can't go into our stores. So we have extra people working at the stores that serve other customers that come through. So lots of measures put in place to keep our community safe, and it's working. What has a COVID response been like in your communities? What have you done to prevent the spread of disease? I think I just answered that question also. So what was the community's response to getting the vaccine? The community response has been great. We knew about 2 days or 3 days before we got the vaccine that the date that we were getting it. So there wasn't a lot of time to start the communication, although we did. And because the way our EMCs operate, we were able to talk about it the day of. The EMCs have their own local communication strategies, and they use them, whether it's Facebook or whether it's by mail outs or just in their local group of community members that they have on Zoom. They have means of communicating faster than we have means of communicating sometimes. And then we use our nation's communications department, and their communications director sits in all of our meetings, helps us with all of the nation communications that we have to draft and put out. And we just make sure that we always have communications going. Early on, the leadership made the decision to I wouldn't say lock down, but to close our territory to visitors. And that happened back in April. So even our members who lived outside the territory were asked not to come home. Normally they would come home during fishing season, hunting season, and our population would more than quadruple. This year, the leadership was really firm in saying, do not come to the territory. It is too high risk for our communities because we live so far away from critical care services. We worked really hard with the province on our medevac services to get it from an average wait of 22.5 hours down to, depending on whether it could be as quickly as 5 hours now, but it took a lot of work. So we also have connected to our EMCs is a primary care group, which is our doctors, our nurses, BCEHS is involved. Anyone who has anything to do with medical or emergency services to our people are involved in that group. And we meet every second week to talk about issues and how we're going to address if we have an outbreak. You know, how are we going to deal with if an elder gets sick? How are we going to move them? Because normally you cannot go with anyone, they have to go alone, but we have put things in place to help support our elders if they get sick. And to this date, thank goodness, we haven't had to use those measures. So what was the other question? Okay, so our community response to getting the vaccine has been great. I've been collecting data from the day we got the vaccine. So I can tell you to date, and this data came in yesterday, because Dease Lake is a split community and it doesn't have, Northern Health Authority doesn't have vaccines. The vaccines we're talking about are only the 600 that we receive for our two communities. 22% of the people over the age of 18 in Dease Lake have been vaccinated, and that right now is the focus of our program. In Iskut, 81% of anyone over the age of 18 has been vaccinated, and Telegraph Creek, 88% of those who are eligible for the vaccine have been vaccinated. I heard somebody mention herd immunity earlier, and what we've come to realize in crunching our numbers is that even if we got 100% of our 18 plus population vaccinated, we still can't accomplish herd immunity because we have 36% of our population is under the age of 18. So, and when we talk to our primary care team, we were told that herd immunity is based on the entire population. So about 70% of the whole population has to get vaccinated before we can reach a 70% herd immunity. So, but we are shooting for getting 100% of those over 18 vaccinated, and so far it's going really well. Those who were hesitant in the beginning are now coming around and wanting the vaccine. We have a few people who cannot get the vaccine due to medical issues. So we have to be aware of who they are and ensure that we have plans in place to protect them, even once the community has all the vaccines done. What was your own experience like getting the vaccine? Didn't feel a thing when they actually gave you the vaccine, except a whole bunch of relief. Like, the sense of freedom after getting that vaccine was unreal. Just the anticipation of not having to live in fear. I am one of those immunocompromised people. I have really severe asthma, so I've lived pretty much in isolation from day one and doing work by Zoom and virtual tools. So it was a real great sense of relief. I was supposed to get my second vaccination today, but I had to postpone it till tomorrow, but I will get my second vaccination tomorrow. And within 3 weeks, 21 days, I will have 95% immunity to COVID-19. And I can't wait for the day when our people all have that same protection. I lost the last question. Okay. What would you like to say to other First Nations waiting to receive the vaccine? I honestly can't wait till all our Indigenous people. In fact, 70% of the world gets that vaccine, because it will give us the opportunity to get back our lives that we have lost in the last year and a half. Sorry. I'm still in emergency management mode. A year. It's coming up on a year. So thank you. I didn't look at the questions. Am I supposed to look at the questions in no?
It's okay. Thanks so much, Betty. Appreciate all of everything that you just shared. I would now like to move on to Dr. Nell Wyman. And I understand she has a short PowerPoint that she's going to share. So over to you.
Thank you. Can everybody see my screen?
Yes.
Great. Okay. Bonjour, Ani. It's really wonderful to be here and with my fellow panelists. My name is Dr. Nell Wyman. I am originally from Little Grand Rapids First Nation in Manitoba, which is part of the Anishinaabe Nation. But currently I live not on my ancestral territory, but I do respectfully acknowledge the land on which I work, live, and play is the traditional, ancestral, and continually occupied territory of the Coast Salish peoples, the Musqueam, the Squamish, and the Tsleil-Waututh. So I am currently working as the acting Deputy Chief Medical Officer at First Nations Health Authority. I'm actually a psychiatrist by training, but during my 20-year career in psychiatry, I actually spent 7 years working at the School of Public Health at the University of Toronto and moved to Vancouver to work at FNHA 3 years ago. So I now work as a physician in public health. So that's sort of who I am and what I do. I have a short presentation to get through, and I will go very fast through the slides because of time. But I just want to, and I can provide these afterwards. I'm more than happy to share my slides. I'm not going to go through these charts in great detail, except to the context really of these slides is to share with you the extent of the COVID-19 pandemic in British Columbia for First Nations. We have had over 3,000 cases confirmed among First Nations people. And there's the regional breakdown in the chart to the left. The sort of more of the majority of cases have occurred in people who live off reserve or what we call away from home, although it's not a huge majority. About 44% of cases of people who have experienced COVID-19 do live on reserve. And oh, sorry, I'll go back 1 second to say that we have had 32 deaths due to COVID-19 amongst BC First Nations. And I always want to take the time to acknowledge those losses for the families, for the communities, and for the nations. Now, I want to talk a little bit about the vaccines, and I don't want to take up too much time because I know that there's lots of questions in the Q&A, but hopefully some of what I say will cover some of the questions. So as people know, there are two main vaccines that are available right now, the Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine needs to be transported in very strict conditions. It needs to be kept at an ultra cold temperature that you need special freezers for, whereas Moderna is a little bit easier to transport in that respect. These vaccines are safe, they work and are effective. They are produced under consistent, high quality manufacturing processes. And in general, the benefits outweigh the risks. And from my three co-presenters this morning, who have, two of them who have personal experience of receiving the vaccine, I don't think that, people cannot have a greater endorsement than that. So that's really important to note. And I also want to, the picture at the top right is just to show people that both of these vaccines, and indeed some of the other ones that are coming in the future, Canada has actually purchased 7 different vaccines, but we are awaiting approval for 5 more, that these do go through rigorous clinical trials. So a lot of people say, oh, but this came, this was developed so quickly. And part of it is because, we have not had a global pandemic in about 100 years. We have had other epidemics, and we have had other small pandemics, but nothing to the scale of what we are seeing with COVID-19. And so that spurred kind of like a global effort to develop vaccines as quickly as possible, is because what some people have already said on this panel, this vaccine is part of what is going to get us out of this situation that we find ourselves in, living under these very constrained conditions, and be able to go back to some sort of new normal. As also has been mentioned, there have been people who have received the vaccine experience mild side effects. And that usually is, as was mentioned, a sore arm, because then the vaccine is given intramuscularly, meaning the needle goes into the big muscle of your shoulder or your upper arm. And it's a small amount of fluid that is injected into, but it can cause muscle pain the next day. People may also experience mild flu-like symptoms, but that is really a sign that the vaccine is actually working. And I put the picture of the COVID vaccine on the bottom left, which I'm sure everyone's seen a million times, but really what's important to note are the red bumps sticking out of the sticking out of the virus. Those are the spike proteins that people talk about. So these mRNA vaccines, they help, once you receive them through the injection, the mRNA, if you think of it, it's like a recipe. It tells certain cells of your immune system, look, this is what that red protein looks like. And you're going to start making that red protein so that the body, once, for example, if you come across COVID-19 virus, your body recognizes it and will go, oh, I've seen that protein before, and will attack and kill it. So it helps you mount an immune response to the virus, even though the vaccine does not contain the whole virus. It just contains that little piece of information to build that red protein that sits outside the virus. I think that's a really important point to make. There have been a few rare side effects that have been noted, as people have mentioned, maybe the swollen arm, but the more severe one is called anaphylaxis, where people have trouble breathing. That's a medical emergency. It's very, very rare, but people are prepared in case that happens. And that's why when you get the vaccine, you will be asked to stick around for about 15 minutes or so to make sure that that doesn't happen. The other thing that has happened on a couple of occasions has been fainting. So some people have had some kind of response where they basically faint. And a lot of the times that has more to do with receiving the actual needle than it has to receiving the actual contents, which is the vaccine. And I've also heard over the past couple of weeks that the vaccine has been rolling out, is that some people have experienced high anxiety or panic attacks because of all the information that's out there about the virus and the vaccine. So the staff who will be administering the vaccine will try to keep people as calm and as reassured as possible. Two of the things we don't know about the vaccine are, once you've had the 2 doses of the vaccine, we don't know exactly how long your immunity to that will last. It may be similar to the annual flu shot, where we have to get a booster shot every year or every couple of years. We don't actually know the answer to that question as right now. And the other one we don't know is whether a vaccinated person can transmit the virus. So you could be vaccinated, you could be fully vaccinated with your 2 doses, but you may still come across the COVID-19 virus and become a carrier of sorts. And so that's why you hear people talking about why we need to aim for herd immunity, meaning most of the people who are of age to have the vaccine, 18 years and older, will be vaccinated, and that creates safety for not just the person who's vaccinated, but for people around them. And it's very difficult in a small community, for example, to achieve herd immunity, as was shared, because other people eventually will start coming in and out of the community as the public health measures are relaxed. And there's, you know, most people in the province, the country, and the world need to be vaccinated so that we can start to move freely again. I will try to wrap it up and save it for any questions. The one thing that has changed over the last couple of weeks are that if you have had COVID-19 infection, you can still be vaccinated. The only exception to this is if you are currently in your self-isolation period for COVID-19. So if you've had a recent positive test and are in self-isolation, the guidance is to remain in your self-isolation until that period is over and wait a period of 3 months to get vaccinated. Also, as was mentioned, people who are immunosuppressed, meaning your immune system has some kind of issue, you have some kind of chronic medical condition, like for example, rheumatoid arthritis, and you're on a treatment that reduces your immune response. If you are an organ transplant recipient, it's not a concrete no, you can't get vaccinated, but for those people, they need to have a very good conversation with whoever provides their health care, whether it's a physician, a nurse practitioner, to decide for themselves whether the risks of getting vaccinated, the risk benefits, whether they whether the chances are they'll receive more benefit from receiving the vaccine than from not. The same advice is now being given for pregnant and breastfeeding women. So if you are pregnant or breastfeeding or know a woman who is, you can ask your healthcare provider about, you know, whether or not you would be considered for a vaccine. In terms of the rollout, I will only say a few things and maybe wait to the Q&A, but at FNHA, we are working to protect the most at-risk individuals and communities first, with a focus on rural and especially remote communities. We are also advocating for a whole of community approach, meaning everyone 18 years of age and over who is willing to have the vaccine, giving their informed consent. We are trying to vaccinate all of those people. Of course, there have been differences. There have been some changes to that exact order in which communities are vaccinated, and that has depended on a couple of different circumstances, including the supply. Right now, the supply of vaccines is very limited in this first month or so. And in fact, you may have heard on the news within the last week, Pfizer has delayed sending more shipments to Canada because of they're making modifications to their manufacturing plants. So there will be no vaccine delivered, I think, next week, but it will start picking up again after that. This initial phase of the vaccine rollout is actually quite limited, although we have vaccinated over 4,100 BC First Nations people have been vaccinated in almost 69 or 70 communities by the end of this week. So we're making good progress. And I also just want to say that I saw a couple of questions about the urban population. So this again is something that's under discussion with our partners. So that is FNHA partners, our First Nations governance partners, regional health authority partners, and our provincial partners as to how that's going to happen. The province is definitely pressing for long-term care residents and staff. And some Indigenous people are already urban Indigenous people are getting vaccinated if they are considered an essential visitor to somebody who lives in long-term care. Additionally, people who work in acute care settings, so for example, emergency departments, ICUs, etc., are prioritized. And we have been advocating all along for the urban Indigenous population to be considered a priority group. And if that indeed happens, because that's still all up in the air right now, it will start probably with the older age groups first. So there will be, say, for example, in some communities, people where we can't vaccinate whole communities, the community has chosen to vaccinate 60 years and older or 65 years and older. There's been some variability, and then it would start going down from there. So probably in 5 or 10 year increments. So 55 years old, 50 years old, etc. But that is still to be decided. And I have to say, you know, I know this is difficult, that we're not able to give definitive dates or give communities, yes, you know, you are number 84 on our list of priorities. It's in a state of constant flux to a certain extent, depending on the circumstances. And the other thing, I will say that, you know, this is really the first time we've all been through this. Trying to organize this kind of vaccination is quite overwhelming. So I think everybody's doing the best we can, and we can be kind to each other and try to stay hopeful. And I'm always happy to hear people's experiences of getting vaccinated. I think that's, you know, one of our best messengers for spreading the word about trying to build confidence in the vaccine. The last thing I will say, I'm sorry I'm taking so much time, but there's so much important information, is once you are vaccinated, you still need to keep up the public health measures. You still have to physically distance. You still have to wear a mask. You still have to wash your hands frequently. And right now you have to keep to your household bubble. And that means the people you actually live with under the same roof, and avoid large gatherings. As I said, we don't know whether you can transmit the virus or be a carrier once you're vaccinated. So once you're vaccinated, it's not like New Year's Eve of years gone by. You can't go all, you know, out running around without your mask and things like that. You really have to stay the course and wait for the rest of us to get our vaccinations. And all of that being said, I just want to say, you know, on behalf of First Nations Health Authority and the team that's working on the vaccine rollout, and indeed all of the public health response, that I raise my hands to you and acknowledge the sacrifices that you have made. This has been an incredibly difficult year, and I really very much appreciate being able to share with you today. Thanks.
Thank you so much, Dr. Nell. Yes, we did go over our time, but I wanted to let you share. I mean, it is really, really important information. You did address some of the questions that were already in the Q&A. So we have about 10 minutes left. I'd like to address as many questions as we possibly can in the next 10 minutes. First question is it possible to get a copy of the PowerPoint? Yes, Dr. Nell will share that with FNPSS, and we'll be happy to share it with everybody who registered for the webinar today. The next question, for everyone, during the lockdown, how did you adapt to the employment and training services? Well, that is a good question. If our panelists, which I believe you're still hiding out in the background, if you don't mind turning your video back on and your audio back on, and if you want to address employment and training in your community fairly quickly so we can try and get through a few other questions, please feel free to share.
I guess I'll share. So everything's been done virtual. So as I had mentioned, our NTC team has, we have a Nuu-chah-nulth Tribal Council emergency planning coordinator. So he deals with a lot of the emergency training, and it's all been online because we don't want to put any risk to our communities.
Thanks so much. What techniques have been found to be the most effective in destigmatizing the virus? Anybody want to touch on that? I know it's been a challenge in some communities when
what was the question again?
It says, what techniques have been found to be the most effective in destigmatizing the virus? So when other community members get COVID, and there has been some negative responses from other community members and stuff like that. So what have either of your groups, any of your groups done to kind of address that and mitigate that?
Well, we always refer back to our traditional and cultural ways of caring for everyone in all cases. So our EMCs reach out quite a bit to support, not that we've had any in our communities, but we have a lot of members outside who've been affected by COVID. So we reach out to them and provide them with support or ensure that they have people around that can help them. It's all about fear, you know, and we keep reminding people that if you follow the protocols that are in place, chances are pretty small that you would get COVID. So it's trying to minimize the fear.
Thank you, Betty. How do you decide who is eligible to get the vaccine first within your community? Is it by age or vulnerability?
I can speak on that one. We went with our frontline workers first, and then myself, just to reinsure the elders. The elders went after I did, it just, everybody was in line. So basically we went from the oldest down to the youngest on a list.
Thanks. Thank you so much, Chief PC. Sorry, there are some questions here in the group chat. I know Dr. Nell did address vaccines being available for community members that live off reserve earlier, and that is probably the biggest question that was asked multiple times. So thank you for shedding some light on that, Dr. Nell, earlier. I want to create an opportunity for some folks to ask a question live. If you use the raise hand button at the bottom of your screen, we can turn on your audio and you can ask your question live. We have a few more minutes left too as well. So if you're interested in doing that, please raise your hand right now. One of the next questions is what is the age of the youngest? What is the youngest age that someone can get the vaccine? Dr. Nell, maybe
18.
18. Thank you. In your nations, have the isolated communities been vaccinated first? So if you have a bunch of different communities, which ones did you decide received the vaccine first?
We have 3 communities. One's isolated, one's remote, and the other one's kind of not isolated or remote. So we went, the 2 communities, remote and isolated, were done first, and then both of those are focusing on the 3rd community to get as many people vaccinated as possible. We were fortunate enough to get enough vaccines for all of our members in 2 communities, and majority of the ones in the 3rd. So the vaccination program is still ongoing.
Yeah, and the only thing I would add is, you know, as I mentioned, you know, the vaccines for us only came through as of December 29th. So it's not even been a month yet. And the initial supply has been very limited. And that will pick up as the months go by. And if there are more vaccines that are approved for use in Canada, for example, there's Sinova is another vaccine that's in development. AstraZeneca, people may have heard about. I think it's approved for use in England already. As more vaccines come online, the federal government, who's procured or bought all the vaccines, has bought more than enough to cover all Canadians in the year 2021. It's our timing and how we roll out the vaccine very much is contingent on having the supply. And then there's a whole bunch of logistics that go into distributing. You know, British Columbia is a huge province, and I've heard of vaccines being delivered by helicopter, by boat, you know, planes, trains, and automobiles to get these vaccines to the communities as they've started to roll out. So it's an immense effort, but it will pick up probably in the 2nd quarter.
Thank you. There is a huge interest, so maybe we can cover it again in hearing about how or when off-reserve members, so anybody who lives away from home, will be vaccinated. So Dr. Nell, if you don't mind sharing a little bit about what you had talked about before, and maybe some of the other nations on how you would address that once that does become available, once you can do that for your off-reserve community members.
Yeah, and I think as some of the other presenters have mentioned, there are instances where, you know, communities, even though they may be in the northern region, are very close to an urban center or right adjacent to. And some cases we've heard about where, you know, some elders live right outside the boundary of the reserve, so to speak, and aren't necessarily considered on reserve. So, you know, there isn't necessarily a black and white about this. And some communities have been making up their own mind about, you know, how they want to roll out the vaccine. So I've heard of some communities inviting some of those close people who live off reserve to come to the community and be vaccinated, provided there's enough supply. So, you know, there's not one way that every single community is going about it. Each community, of course, has the self-determination to decide how they want to distribute the vaccine in their communities. But for the urban population living in, I think what people are thinking of is in larger centers, there is right now, there isn't a definitive kind of plan in place of how that's going to happen for Indigenous people or First Nations people, as I mentioned. This is still a very much an ongoing discussion. It is partly limited by supply, and it is partly, you know, dependent on us being able to advocate with the provincial government and the regional health authorities that we should be a priority group. So we will continue to work as hard as possible to make that happen, but there has been no answer given again about, you know, we can't definitively say this is when, if you live in downtown Vancouver, you're going to be able to access a vaccine if you're a First Nations person. We don't have that information just yet.
Thank you so much. We are at the end of our time. Just to reiterate that this webinar has been recorded and it will be available on the First Nations Public Service Secretariat YouTube channel, which I'm hoping Bronwyn in the background could post that in the group chat or YouTube link so that you can access it. Hopefully it should be available by tomorrow, but there are over 30 other webinars. We try to do these fairly regularly on a variety of different topics, and we started them in the beginning of March, and they're mostly nation to nation sharing about their various experiences in addressing the pandemic in their communities. So I encourage you to check out the YouTube channel. Maybe there's some information, some helpful tips from other communities that are experiencing the same thing. I want to thank all of our panelists for joining us today and speaking and sharing your experience. Much appreciated. This is the beginning, I would say, to hopefully going back to normal. Appreciate all your good work in your communities to ensure the safety of all of your community members. So I raise my hands to all of you. And thank you to everybody who's joining us and watching us. Stay healthy and safe out there, and we will see you at the next webinar. Have a great day. Bye-bye.